countries won war. No guns, no bombs. But it could kill people slowly. The China-US trade war isn't just about money or politics. It's about lives. Your life, my life. People in hospitals, babies in need of medical care. Today with Public Health Sis, let's talk about something no one else is saying loud enough. How tariffs are quietly breaking healthcare systems around the world. So a tariff is sort of like tax one country puts on stuff coming from another country. So when the US says, hey, if you send us medical gloves, we will add tax. That's a tariff. Now imagine this happening to hundreds of thousands of items, machines, medications, and even surgical tools. In 2018, the US slapped heavy tariffs on Chinese goods. China hit back and boom, a full-blown trade war. Now here is the part they don't tell you. A lot of the medical equipment hospitals use every day, like thermometers, syringes, gloves, even parts of ventilators, come from China. Even simple things like bandages are often imported, especially in countries where local production isn't enough. When tariffs go up, the prices go up too. And when prices go up, some hospitals can't afford them anymore. When hospitals and clinics run out of basic supplies, guess who hurts? The patients, of course. You could be waiting for hours, not because the hospital is full, but because they are missing key supplies. Here's the thing. Tariffs don't just raise the price of stuff. They drain health budgets. Governments already don't have enough money for healthcare. And now with the trade war, it's getting even worse. The implication is that the extra costs are passed down to the hospitals and to the patients. It's not just the governments getting hit. Healthcare workers feel it too. When the cost of equipment go up, hospitals and clinics can't get what they need. This means that doctors and nurses don't have the tools to help people. Tariffs don't affect everyone the same way. Big hospitals in cities can manage, but the small clinics, especially in poor rural areas, they get hit the hardest. Imagine having to travel hours to the nearest hospital, and when you get there, they don't have what you need. That's the reality for many people in some low-income countries. Remember what happened during COVID-19? Supplies like oxygen machines and PPEs were delayed because of tariffs. Some countries had to ration ventilators because the parts didn't arrive on time. Imagine a clinic in a rural area. They barely get funding. Now they have to choose. Buy fewer gloves or buy basic machines. That's not just uncomfortable. That's outright dangerous. While pharmaceuticals are exempt from the tariffs, the ingredients and the materials for the drugs, as well as medical devices, are not exempt. Many of the raw materials used to make antibiotics and other drugs come from China. Tariffs disrupt that, so manufacturers either slow down or raise their prices. Imagine being told prices went up each time you go to the pharmacy. People have to choose between buying food or medicine. And it's the people who are already struggling that suffer the most. This trade war isn't just between China and the US. Poorer countries get caught in the middle. Many of them depend on cheap supplies and donations from these two giants. With tariffs driving up prices, many health organizations can't afford to buy what they need. And when they can't buy, they reduce the scope of their health programs and campaigns. But it's not just the medicines or equipment that is affected. The entire health system starts to slow down. When hospitals can't get what they need, they cut back on services. Waiting lists grow longer, treatments are delayed, and hospitals start turning people away. This happens in places where people already don't have access to proper healthcare. They need treatments, they need surgery, but there's just no way to get it when the health system is running on empty. It might seem overwhelming, but there is hope. Countries are now learning to build local supply chains. Kenya and Ghana are producing their own PPE. Nigeria is investing in local pharmaceutical factories. And medical students use 3D printers to create face shields for health workers. The lesson is that we must stop depending on global powers for our survival. We need health independence. These solutions prove that we don't always need to rely on import. When we work together, we can solve problems ourselves. The global health community is starting to respond too. The World Health Organization is pushing for medical supplies to be treated as essential, meaning no tariffs on them. It's a slow process, but change is happening. And as more countries are seeing the damage tariffs are doing, some countries are starting to include healthcare in their trade talks. They are saying we need tariff-free medical supplies because people's lives depend on it. So things are moving in the right direction. We are starting to see a shift, but it's going to take all of us, governments, health workers, and every single person to make sure the system works for everyone, not just the rich. Tariffs are more than just taxes. They are a threat to our health, depending on where you live. The China-US trade war may be across oceans, but its pain is in our homes, hospitals, and in our very bodies. It's time we paid attention because behind every tariff, there is a patient waiting to live.